Good day everyone, I am Kurt Anguscado from Our Lady of Fatima University. So today we will be doing a bed bath to the patient. So before we proceed to the procedure, we will be reviewing the chart of the patient so that we will see if there's any limitation or hindi magawa ni patient throughout the procedure. Okay, next is prepare all the necessary equipments para ma-maintain yung convenience and organize the procedure. So here's the equipment already prepared na. And then next is perform a hand hygiene to prevent transmission of the microorganism. And then next is identify the client. So hello ma'am, good morning. May I know what is your name? Your birthday ma'am?
August 14, 2007.
Can I see your ID bandwidth so that I can verify it? Okay. Okay, next is close the door or the windows to give a patient privacy. And then next, offer patient a bedpan or urinal so that during the procedure, there's no chance na makakapupo or ihi si patient at wala nang lilinisan pa. And then next is perform hand hygiene again and put on clean gloves. And then after putting on clean gloves, we will be removing the linen underneath the patient. So ma'am, ask the patient to side. So ma'am, can you go side? Okay ma'am, the other side naman. Okay ma'am. And then remove the gown of the patient. So ask the patient to sit down and then remove the gown. Okay, ma'am, you can. And then we will be starting the procedure, giving bed bath to patient. So first, we will be placing a towel in the patient chest. Okay, and then next, rinse the towel with na walang sabon, and then wipe it in the patient under eye. So I will be using the corner, and then the other side. And then next, rinse it again and wipe it in the patient's face, ear, and neck. And then wipe it with a dry towel. And then next, rinse the towel again and wipe it to the arm and the armpit. So remove the towel and ask patient to raise their hand and raise the towel again. So swipe it to the arm, then use the alternate side for the back arm and armpit. Then the other side, other arm. And use dry towel to dry it. And then next is rinse the arms and fingers of the patient with na may sabon. patient na ibabad yung kamay. Okay, ma'am. Okay po. And patuyuin po natin gamit ang dry towel. And then next, rinse po again yung towel. And then i-wipe po natin siya in the chest area. So, i-move po natin yung towel, pababa. And then, wipe it in the chest area. And then, move the towel in the chest area. Diba? And then, wipe the abdomen area. And then, rinse the towel. And ask the patient to sit po. Remove first the towel. And ask the patient to sit. Okay, ma'am, can you sit? And wipe it in the back. And then, use a dry towel to dry. Okay, ma'am, can you? And then, put back the towel. And then next, rinse again the towel and wipe it to the leg area, going to the foot. And use dry towel para mag-dry. Mag-dry. And then, after that, offer or apply a moisturizer to the patient to prevent the dryness of the skin of the patient. So, ma'am, I will be applying a moisturizer to this. And then, cover the patient face. And then, remove the towel on the chest area of the patient. And then, return the gown of the patient. So, ask the patient to sit. And, kuha kayo ng bagong gown para to prevent the cleanliness of the patient. Diba? Other side. And then return the linen underneath the patient. So ask the patient again to roll or to side. Imam, can you use to the left and put the lining back. Imam, can you the other side. Imam, and then remove your gloves and perform hand hygiene. So, and before leaving the patient, make sure leave the patient clean and comfortable. So, ma'am, how do you feel after the procedure that we do?
Okay.
Do you feel well naman po? Yes. And then, that's it.
Now
we will be giving a oral care to the patient. So first, assess the oral hygiene of the patient. Hello ma'am, I am your student nurse for today and now we will be going to give you a oral care. So, kada kailan po kayo nag-toothbrush ma'am?
Three times a day po. Morning, lunchtime, and evening.
Very good ma'am. So, ano po yung, do you use mouthwash ma'am?
Yes po.
Oh, very good po. So, okay ma'am, thank you. So, next, I will be preparing the equipment. So, as you can see, I already prepared the equipment. So, yeah. And then next, I will be performing a hand hygiene. And putting all on the clean gloves. And now we will be starting brushing the patient teeth. We will be starting in the upper area. So ma'am, can you open your mouth and show your upper teeth? I'm gonna brush it now, okay? The other side po. And then, grab the water para mahugasan. Okay ba? And then next po is in the lower area ng teeth ng patient. Okay ma'am, yung lower teeth naman po. And also include the tongue. So ma'am, labasin po yung tongue. Okay ma'am, and then grab the water para mahugasan. Stick na po. Okay, thank you. And then next is offer floss to the patient if kaya niya mag-floss. So, ma'am, kaya niyo po ba mag-floss? Okay. Then po, balik niyo po sa akin after niyo po mag-floss. Okay po. And then, give patient a mouthwash po. And also apply lip balm to the patient lips to maintain the moisture of the lips. Kaya na po ba mag-apply or ako na lang po?
Sige po, ako na lang po.
Okay po. Thank you po. And then remove the equipment and remove the gloves and perform in hand hygiene. Now we will be doing shampooing the patient hair. So first, we will be doing a hand hygiene. And then prepare all the necessary equipment. As you can see, the equipment that are used into the procedure are already prepared. And then review the chart of the patient so that we'll see if there's any limitation in patient's physical activity. And then I will be putting my plain gloves. And then lower the patient head by removing the pillow under his or her head. So now we'll be removing your pillow. And then put the waterproof linen under the patient's head. So now we'll be putting it. Okay, ma'am. And then place the drink container under the patient head. And then place the towel in the patient head para hindi mabasa yung head ni patient. Lalagay ko lang po ito. And let's begin the procedure of the shampooing of patient hair. So first, rinse the patient hair in water that has 43 to 46 degrees. apply a shampoo in the patient hair and slowly and gently massage the scalp. And rinse it with water. And then apply a conditioner if patient requests. So the patient requests to apply it, so I will be applying it to her hair. And slowly and gently apply it to her hair. And after that, rinse it with the water. After rinse it in the water, grab the dry towel and put in the patient hair. And keep this dry towel until the patient hair is dry. And then brush the patient hair. And then after that, remove the water container. And then remove the waterproof pad under the patient head. Also remove the towel in the patient head. And put the pillow back under the patient head. And then remove the gown of the patient and change it in another clean one. So, and then remove the equipment and remove the gloves. And perform a hand hygiene. And that's it. After giving patient or shampooing the patient hair, now let's offer the patient a back massage. Before we proceed, explain the procedure to the patient. So, hello ma'am, I am your nurse for today. So, I will be offering you a back massage so that to promote a relaxation, comfort, and circulation to your body. So, do you have any questions, ma'am? Okay, ma'am. So, now I will be performing a hand hygiene and putting a clean box. And then assess the patient pain, specifically in the back, because we offering a back massage. So, ma'am, do you have any pain po? Specifically in your back, ma'am, do you feel any back pain recently?
Wala naman.
Okay. So, next is assess the patient to position in prone-lying position. So, ma'am, dapa po kayo. Kaya niyo po ba, ma'am?
Yes po.
And then, next, before we start the back massage, warm the lotion in a small basin of warm water para hindi mabigla yung back ng patient. And before we while we waiting to the lotion, ask the patient if ano po yung prefer niya, if lights, in lights and sa temperature ng room. So ma'am, ano po yung prefer niyo? Lights on or lights off?
Lights on po.
Sa temperature po, open po ba yung aircon?
Yes po.
Okay. after that, remove the gown of the patient. Sa back area lang, since mag-open tayo ng back. And then, we will be starting the back massage, starting with ethno-wrench or stroking massage. So, apply a lotion in your hand and spread to the back of the patient. I will be doing the ethno-wrench or stroking massage. Is there anything na? Paginin mo lang po kung may masyado pong malakas yung pressure ko. Okay, next, I will be doing the friction massage. Same lang po, sabihin na po kung masyado malakas yung pressure na kami. Okay, next is the tapot massage. So, same lang din po, sabihin niyo po if masyadong malakas yung pressure. Next is the kneading massage. Sakit po ba, ma'am? Okay. The next is assist the patient now to wear the gown. And assist the patient to the comfortable to sleep. So, ma'am, kapag na po ako. Okay. Next, do evaluation. So, ginawa niyo back massage sa patient. So, ma'am, kamusta po kayo? Ano po nararamdaman niyo? Ano po yung nararamdaman sa back massage niyo?
Okay naman po. Okay naman po.
And then, remove the gloves and do a hand washing. Hand hygiene.